Most people think diabetes only starts the day a blood test confirms it. You go to the doctor, wait for the lab results, and only then find out there's a problem. But in reality, the body often starts sending warning signs much earlier, and one of the first places those signs can appear is the feet. That's why this matters. Because what many people dismiss as aging, poor circulation, or simple discomfort may actually be an early clue that blood sugar has been running high for a long time. I've seen this happen again and again. Someone comes in for a routine visit, convinced everything is mostly fine. Then I ask one simple question: have you noticed anything unusual in your feet? And suddenly the real story comes out. Tingling, burning, cracks, swelling, a wound that won't heal. Symptoms they've been living with for months, sometimes years, without realizing they may all be connected. So today, I want to show you 9 warning signs your feet may reveal before diabetes is officially diagnosed. These signs often seem small, harmless, and easy to ignore. But sometimes they are the earliest clues your body gives you. The first sign is tingling, numbness, or pins and needles in the feet. Most people assume it happened because they sat too long or slept in a strange position. And sometimes that's true. But if it starts happening often, especially without a clear reason, it deserves attention. Your nerves are like electrical wires. When blood sugar stays high for too long, those wires can start to lose their protective covering. The signals still travel, but not properly. That distortion can show up as tingling, buzzing, or numbness. A simple habit that helps is daily walking. Even 20 to 30 minutes a day can support circulation and help the body use glucose better. The second sign is burning feet at night. This one often appears when you're trying to sleep, which makes it especially frustrating. Some people describe it as heat in the soles of the feet, or a feeling that their feet are on fire under the blanket. The strange part is that the skin may not actually feel hot. That's because the sensation may be coming from the nerves, not the surface of the skin. Think of it like a smoke alarm going off when there's no smoke. The room isn't on fire, the sensor is malfunctioning. Damaged nerves can do the same thing. Drinking enough water and eating more fiber-rich foods can help support better blood sugar control over time. The third sign is one of the most serious: a cut, blister, crack, or sore that doesn't heal properly. This is something many people underestimate. They assume it will get better on its own. But when blood sugar remains elevated, healing slows down. Tiny blood vessels may not deliver oxygen and nutrients as effectively as they should, and that means even a small wound can linger much longer than expected. That also increases the risk of infection. This is why checking your feet every day matters. Look at the soles, heels, toes, and between the toes. Problems often get worse simply because people never notice them early enough. The fourth sign is changes in skin color. Some people notice redness, darker patches, a bluish tint, or skin that just looks different than it used to. Because these changes often happen gradually, they're easy to ignore. But skin color can reveal a lot about circulation. Healthy skin depends on a steady flow of oxygen-rich blood. When that flow weakens, the skin may start to show it. If one foot looks noticeably different from the other, or if the color change keeps returning, that's not something to brush off. The fifth sign is dry, cracked heels that keep coming back. Dry skin is common, yes. But there's a difference between normal dryness and heels that become rough, split deeply, or keep cracking no matter what cream you use. This can happen because diabetes may affect the nerves that help regulate moisture in the skin. In other words, the dryness may be coming from deeper than the surface. Those cracks may seem minor, but they can become entry points for bacteria, especially if circulation is already reduced. Applying moisturizer to the heels and soles before bed can help, but avoid putting it between the toes. The sixth sign is swelling in the feet or ankles. Many people blame swelling on standing too long, sitting too long, or eating too much salt. And sometimes that's true. But if swelling becomes frequent, if your socks leave deep marks, or if your feet look puffy most days, it deserves attention. High blood sugar can also affect the kidneys, which help regulate fluid balance in the body. If that system starts struggling, fluid often settles in the feet and ankles first. Elevating your feet while resting and reducing heavily processed salty foods may help, but persistent swelling should never be ignored. The seventh sign is foot pain that feels strange or hard to explain. Some people describe stabbing pain, electric shock sensations, aching, or discomfort that gets worse at night. Many assume it must be arthritis, an old injury, or simple wear and tear. But nerve damage doesn't always cause numbness. Sometimes it makes the nerves overly sensitive instead. Imagine a car alarm that keeps going off when nobody touched the car. That's what irritated nerves can do. The pain is real, but the source may not be what people think. The eighth sign is feet that are constantly cold. A lot of people say, "My feet have always been cold." And sometimes that's harmless. But if your feet feel cold even in a warm room, even under socks, even when the rest of your body feels comfortable, it may point to reduced circulation. Think of your blood vessels like heating pipes in a house. If those pipes narrow, the rooms farthest away stop getting enough warmth. In the body, the feet are often the first place to show that. And the ninth sign is one almost nobody talks about: less hair growing on the feet or lower legs. It sounds odd, but it can matter. Hair follicles need oxygen and nutrients too. If circulation weakens, they may stop functioning the way they used to. This usually happens gradually, which is why many people never notice it. But it can be one more clue that blood flow to the lower legs and feet isn't as strong as it should be. Now let me be clear, none of these signs alone proves you have diabetes. A symptom is not a diagnosis. But these signs can be your body's way of asking for attention. And one of the biggest mistakes people make is waiting too long. So here's what I want you to do tonight. Before bed, take just 30 seconds and actually look at your feet. Check the skin. Notice the color. Most people spend more time checking their phone than checking the body carrying them through life. That needs to change. If even one or two of these signs sounded familiar, don't panic. But don't ignore them either. Ask the question. Request the test. Pay attention now instead of waiting for something much bigger to force your attention later. Because sometimes the feet tell the story first, and the people who do best are often the ones who listen early.